someone lose responsiveness. The severity of a head injury depends on how someone hit their head and how hard the impact was. A head injury can cause damage to the brain tissue or to the blood vessels inside the skull and even break the skull, as in a skull fracture. Clear fluid or watery blood leaking from the ear or nose and a deteriorating level of response are some signs of serious injury. Now, these are the most common things which can happen if someone has a brain injury. There could be concussion, that is a brief period of unresponsiveness. With someone with concussion may be confused, but only for a short time, and that followed by complete recovery. There may be cerebral compression. A severe blow to the head can cause bleeding or swelling inside the skull that can press on the brain, and this is called cerebral compression and is life-threatening. Now, if there's a head wound, this can be a sign that there may be deeper damage within the head, for example, like a crack or a break in the skull fracture, which may be serious. A spinal injury. You should always assume that anyone who has a head injury may also have a neck or spinal injury, so treat them for this as well. The 6 key things that you should look for with head injuries: brief loss of responsiveness, scalp wound, dizziness or nausea, loss of memory of events before or during the injury, headache, confusion. And if you have suspect severe head injury, also look out for reduced level of response, loss of responsiveness, leakage of blood, watery fluid, and unequal pupil size. To start treating them, sit them down and give them something cold to hold against the injury. You can use a cold compress, a bag of ice, or frozen peas wrapped in a cloth. Treat any scalp wounds like a bleed by applying direct pressure to the wound. Check their level of responsiveness using the AVPU scale. Now, this is not anything rude. AVPU refers to the alert, voice, pain, unresponsive. Alert. Are they alert? Are their eyes open? Do they respond to questions? Voice. Can they respond to voice? Can they answer simple questions and respond to instructions? Pain. If they're not alert or not responding to your voice, do they respond to pain? Try pinching them. Do they move or open their eyes? Unresponsiveness. Do they respond to questions or a gentle shake? If they are alert or responsive, their head injury is probably mild, but you should wait for them to recover. If they're not alert or responsive, they may be partially or fully unresponsive, and the head injury could be severe. Call 999 or 112 for an ambulance and explain their response to the AVPU test. If they lose responsiveness at any time, open their airway, check their breathing, prepare to treat someone who becomes unresponsive. And while you're waiting for an ambulance, keep checking their breathing, pulse, and any changes in the level of responsiveness. And also just speak to them, really, because hearing is the last sense to go. So just speak to them and tell them that someone's with them and that there is help coming, and even just what you're doing, just to make sure, and chances are they'll remember these things. Anyway, check the level of responsiveness, make a note of their reaction, and call the ambulance if you really need to. These are some of the things that you should look at. Also, if someone is over 65, someone may have been drinking or taking drugs, been unresponsive for even a few seconds. If you think they're getting worse, encourage them to get medical help. And these are some of the things that you can do to actually help them. This is Gospel for Grampian, Gospel Community Radio for North Scotland, engaging, equipping, enabling communities to live life to the full with Christ Jesus at the centre.